Thank you guys so much for being here again. I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. I really appreciate you guys hopping on today. If you guys are here, you're here at the very beginning of the live. And if you have questions, just drop them in the chat. We can talk about everything. We can talk about skincare products, different skincare conditions, any of that. If you got friends that love skincare, feel free to invite them to the live. If you hang out and watch this, you're going to learn a ton about your skin. We'll talk about a lot of the most common asked questions because we're taking questions right from the chat. So if you have them, just drop them in the chat. If you're here and this helps you, drop a like. So we're here for you. Natasha, thanks for the follow, by the way. So thank you, thank you. So beef towel, I'm not really about it. And newest skincare, I'm seeing it all over TikTok right now. It's everywhere. But I will say this, with Anua, I have it here at the house, but I haven't tried it yet. Purple face, don't know exactly what's going on in that, but I've seen a lot of rosacea that looks really, really bad. Packers all day, Trevor. That's a very easy question, the easiest one I've asked all day. What's the treatment for squamous cell carcinoma? Generally, all skin cancers ultimately, well, primarily are going to be surgically treated. So that's going to be the main key. Very dry palms, I would lean into good urea-based moisturizers like the La Roche-Posay Triple Repair with urea. That's a really good one. Forehead acne, if you guys are treating acne, you want to treat them the same way that you treat any other acne. You want to be using a good, I'd say a salicylic acid or benzoyl peroxide wash in the morning, and at bedtime you want to use adapalene or tretinoin. Tretinoin is one of the best medicines that you can get for your skin, and it helps with all kinds of things. That skin texture, preventing acne bumps. It can help with all those. So that's very, very key. So I did 12 years of schooling to do that. Blood vessels popping up on the face, you got to do things like XLV or PDL or IPL or BBL. These are laser treatments. There's no topical to get rid of blood vessels on the face, guys. So thank you guys so much who tapped that screen. Keep tapping the screen if you like. 10% niacinamide, sometimes a little strong for some people, but I am doing a video soon on YouTube, and you guys can follow me on SwoleMD Skincare on YouTube if you want to, with a product that contains 10% niacinamide. It's the Mela B3 from La Roche-Posay. It's actually got a little stronger niacinamide, but it's a formula that's made to fade dark spots. So they've kind of, used that stronger niacinamide to help people, improve their skin. So dark spots and itching on both legs. Moisturizing your skin is one of the best ways to prevent itching. I think that's very key. So using something like the CeraVe Itch Lotion or Sarna Sensitive is very good. The dark spots are a whole different beast, because if you're scratching and itching on your legs, you're going to leave what I call the crime scene behind. When you scratch and pick and dig at spots, it's going to leave hyperpigmentation behind. Keratosis pilaris, best treatment, probably rotating amlactin lotion, which has ammonium lactate in it, and CeraVe SA lotion. So I'd rotate those. Just so you guys know, if you guys don't, if you don't see, your question doesn't get answered, or you're wondering the best lotion, what's the best skincare routine, what's the best treatment for dark spots, if you tap the link in my bio, you can go to my ShopMy or my Amazon, and on there, I have all my favorite skincare products organized by type. Here's the other thing I'll say, and this is really sad for me. So I don't know. Today's the 12th, right? TikTok may be getting shut down in 1 week. I think that's really, really sad, because I've been on this platform literally for 4 years helping people get their best skin. So I love TikTok, and it's incredibly, incredibly sad. I don't want to lose the connection I have to all you guys. I've always said it's been so amazing to be able to reach so many people. On TikTok alone, I have about 145,000 followers on here. So I love helping you guys so much, and I'm really worried I'm gonna lose this community. So if you guys want, you guys know you can follow me on YouTube, you can follow me on Instagram, and I'm happy to help you. I've been on here literally basically every day for over the last, 4 or 5 years, long time. So really sad. I hope something happens, where maybe we get to keep this, but I don't know how you guys are feeling, but maybe if there's a few sad people out there, put the cry face in the chat. I know there's probably a few people out here that feel like I do about it. So face gets oily fast, little bumps. I would definitely be using, La Roche-Posay, adapalene. I see you, Natasha. I feel you. I'm sad. The worm matrix. Sorry. Yeah, I feel you. So we were talking about oily skin and bumps. I would definitely be bringing in the adapalene. So adapalene is a really, really great treatment overall. for bumps and also the oiliness. You could also bring in some niacinamide. So I really like the Kiehl's niacinamide. I think it's a very good one. If your face, almost everybody's face after going in hot water is going to be a little dry and itchy. So especially in the winter months when the humidity is very low. So during these months, you got to moisturize right after that. Ariel, I'm so happy to help. I love helping you guys. You know, whatever pops up, you know, I think there's somebody else will, you know, some other platform will fill the space, but I would rather keep this, you know, platform here. So Dylan asked about pores on the nose. Minoxidil is safe for women. So Dylan, as far as the pores on the nose, I wanted to say, with the pores on the nose, best treatment that's out there right now is a brand called Remedy. They have a product called Remedy for pore size. That's probably your best bet for treating pores in the nose, sebaceous filaments. Can they freeze SCC the size of a pencil eraser on the nose? There are minor blood vessels. So there are some places that might do this. And depending on the squamous cell carcinoma, there's different levels of it, right? Squamous cell carcinoma in situ is like the least invasive version. And sometimes those are treated. Now, the face and the lips and the hands, these are high-risk sites, the ears. So it's definitely best not to treat those areas with cryo. Now, if you're, say someone was very old, they didn't want to go through surgery, maybe this is an option, but it's certainly not the best one. Clean and organized with me. Like the name, by the way, I probably should follow you and learn from you as well. So Prasha says some tips for dry skin people. So I actually just did a video, I think yesterday, on dry winter skin. So I definitely check that out, Prasha. It's a really good video, but some of my favorite moisturizers right now for the dry, itchy skin would be the La Roche-Posay Triple Repair Moisturizer. You want to soak and seal. So you want to be hydrating your skin within 3 minutes of getting out of the shower, and you want to moisturize again before bedtime. Humidifiers in the bedroom at night can also help a lot. And then, can I spell some of those fancy names? Yeah, I definitely can. I don't know if I can chat on here. I don't know if that will send. I don't think it will, but so the fancy names, some of the things we've talked about is Kiehl's. So it's Kiehls. Oh, that did go through. La Roche-Posay is working too, so I'll send that as well. La Roche-Posay is a very good one. And acne scars in the cheeks, you're going to do things like chemical peels, lasers, stuff like that. Microneedling, potentially. These are good options. You know, any of these are good options. Castor oil every day, and at night, only a skincare. I think I'm not personally about that. I think there are some skin oils that I like. Like marula oil, but castor oil, it's been hyped lately, but I'm not really about it. Laser hair removal does help some people. I like marula oil, Diego. I'm not really a big fan of castor oil. So biologics to treat granuloma annulare. More so lately, you see people off-label treating with JAK inhibitors, which have helped some people. But a lot of times we use things like doxycycline, hydroxychloroquine, and some biologics that have been very helpful in bad cases is things like Humira. So those are ones that can be done. Is eye cream a waste of money? A lot of people say it is. So Prasha, I don't know. I'm 50-50 on this because eye cream in general, I feel like when anybody makes a product, they don't, you know, they're not trying to make products that are going to irritate your skin or, you know, they want to make products that you will continue to buy and use, right? So a lot of times these things are more similar than different than the rest of your skincare routine. So overall, but sometimes I feel like you get an eye cream that's a little bit more gentle, a little bit more formulated. Maybe it's similar to the facial cream, but it lacks the fragrance, for example, because, you know, your eyelids are some of the most absorbent skin on the body. Or maybe, you know, there's a stronger retinol for your face, but there's a very mild one for the eyes. So sometimes it can be worth it. And, but overall, you could stretch things like your moisturizer. Can you use your moisturizer on your eyes? Of course. Is that going to make your eye skin look a lot better? It definitely will. So I don't know. I'm kind of 50-50 on it. There's a few eye creams that I really love. I love the Brandify eye cream. So the Brandify eye cream is very good. You can use a Greeney 40 as a code, get it 40% off, which is pretty amazing. I also like the Versed Smooth Landing Retinoid Eye Balm. Carrie, we talked a little bit about laser hair removal and HS. So for that, it does help some people, but it's not a perfect solution for people. Good for brown spots on the face. Right now, the best product that's out for brown spots on the face is Remedy for dark spots. So Remedy for dark spots is very good. It's a very nice option for that. And you're very welcome. Try Nizoral. If you try Nizoral and it's not really helping a ton, one other thing you could do a little tiny bit of mild hydrocortisone, like a 1% hydrocortisone is good. You can get that over the counter. Another thing that could be very helpful that you could try is there is a new shampoo that just came out, and it's called Vichy. It's Vichy Durcos. So Vichy Durcos actually was on the team seeing this come to light. So Vichy Durcos, it was a really, really nice option overall that trying to see if I could pin that. I don't know. I'm surprised I can't. So Vichy Durcos is really, really good. It is a type of selenium sulfide. So a lot of times when you get that kind of dandruffy rash on the face or eyebrows, take care, Prasha. Take care. Malassezia yeast that's on our face plays a big role in that. So these selenium sulfide, it kind of reduces that yeast burden. So that can help. Best product for acne scars, if I had to pick only one thing, it's probably going to be retinoids. So doing things like La Roche-Posay adapalene. So that would be one of my favorite. I would do that. So, and then Viv, sorry, has a question. So I'm ready for you, Viv. When you're ready, just send it. So Original Cinder, I saw you just requested to get in the live. At the moment, I don't really think I haven't really set up well to do that, unfortunately. So you just have to ask the questions in the chat. What would you recommend for milia? Salicylic acid. Salicylic acid washes like a 2%. I really like that. Is Supergoop moisturizer bad? I personally haven't used anything from Supergoop that's been bad. I'm a huge Supergoop fan. Love Supergoop. So I don't think I knew they made moisturizer though. I've always used their sunscreen, so maybe I need to try those. So Andrew says, what do you think about cryotherapy for surgical scars, particularly in hair-bearing areas? I don't think that generally is a good idea. Cryo is pretty rarely used for surgical scars. I mean, sure, there's a possibility that it might kill fibroblast, but the risk of hypopigmentation and hair loss is not a good idea. I definitely don't think that's a good idea. It's not a common idea. There's a lot better ways to address surgical scars. Things like you could potentially do lasers, you could do microneedling, you could do injections with steroids or Effudex, different things like that. It just kind of depends. So, but cryosurgery or cryotherapy, I don't know, when you say cryotherapy, I guess I don't know if you mean like just cold exposure or like spraying liquid nitrogen on something. So Viv says, I got new skincare, but I started getting these tan bumps on my forehead and it's going under my eyes and I have big red eye bags. And it's like the skin color bumps, but I don't know what it is, kind of tiny pimples, but super tiny. So just depends, Viv. I mean, if you have noticeable red eye bags, then I kind of feel like there's a possibility you're having a contact issue to some of this new skincare. Now it's tough because you got new skincare, so you might have got a few new things, started them all at once, kind of thing. So it might be hard to nail down exactly what's causing it. But what I would say is really reel it in, maybe back off for a little while, give your skin a little time to cool down, and then integrate just one product at a time. Because if you put a lot of stuff in your routine at once, it's hard to know exactly what did it. Now, the trouble is when you get a contact allergen, it's almost like poison ivy. Sometimes you can be on something and you might get a rash that lasts for 4 to 6 weeks after that. So it's kind of tough. But for the time being, you might want to just back off, go to gentle cleanser and moisturizer, and then integrate those new products slowly but surely. The bumps can come from irritation. They could possibly be comedones, like like acne type bumps too. But backing off, taking it slow. Skincare is definitely a marathon, so it's not a race. So just take your time with it. And then Sunflower says, how do you get rid of lichen simplex on the scalp? So lichen simplex is essentially like an itching reaction, right? Now, sometimes this is done for like psych reasons, meaning like anxiety. So you're sitting at home at night, you're a little bit worked up, you're a little bit stressed out. So you start to pick or scratch your scalp. your skin goes through an issue where it will start to thicken up some, right? So as a defense mechanism, when your skin gets rubbed enough, it starts to thicken, and that almost gives you something more to pick at, because now you've got this bump on your skin, which can be really frustrating. So I would say, even though it kind of stinks in the beginning, if you've got a very noticeable bump on the scalp that's itchy, just put Vaseline on it. And you want to just put a small amount, put it down on your scalp, and do that, because a lot of times as humans, we are very prone to picking and scratching at things. But when we get our hands all greasy, like you go to scratch something and you get your fingertips greasy, we're always using our phones and stuff. We don't want our hands to be greasy. So it kind of breaks that habit. And it sounds very cheesy, but one of the best ways that I've helped people break these habits is get something like a worry stone, which is just a flat, smooth rock. You could find them anywhere. And as soon as you go to scratch, especially if you have to in the beginning, put the Vaseline on it. Oh man, I'm greased up, I've been scratching. Use the worry stone, switch the worry stone. Do that for a few weeks. That'll help you get past that habit. So that's a great question though. Best silicone scar tape for fresh scar. I actually don't have a favorite on that. I think that anyone that you do, you're in good shape. Silicone in general has great evidence for it. So I would definitely do that. And Sunflower, that's a great question. Your doctor also, Sunflower, can help prescribe medicines that would help decrease your itching. Things like topical steroids, those kind of things can help. So flaky hairline and eyebrows and ears, Selsun Blue and Izorel are no help. So I would try Vichy Durcos. It's micronized selenium sulfide. So there are some overlaps there with selenium or Selsun Blue, but just know you might also need a topical steroid, which you have to get prescribed from your doctor. Open pores on the nose cherry, I would definitely go with the remedy for pore size. It's a really, really great option made by my good friend, Dr. Shah. And you guys have probably seen it on TikTok because it's so popular. So again, I want to just introduce myself again, because there's a lot of new people here. I'm Dr. Dylan Greeney. I'm a board certified dermatologist. It's kind of a sad day because we're about probably 1 week out from TikTok getting banned potentially. I think we all have our opinions on this. I mean, we're all obviously on this app, and I personally love it. I've been able to reach literally hundreds of thousands of people to get their best skin on this app over the last few years. As a dermatologist, you know, I only see about 34 people a day in the clinic. And on here, any given time, you know, sometimes you get a video that goes to millions of people, and you can reach a lot of people. You can educate a lot of people. I think more young people than ever are using sunscreen because of the dermatologist on this app. So, you know, it's a very kind of sad day. But I would say if you guys want to continue following me, you can look me up on Instagram at SwoleMD. You can also get me on YouTube, SwoleMD Skincare. I'm going to do my job today to try to make more long form videos for you guys. I also do shorts and all that. I do shorts on Instagram. I do shorts on YouTube. So I want to be here for you guys. I'm hoping it doesn't get shut down. It's really sad. So really hope it doesn't, but I know we all have our own opinions on that. And Sunflower, thanks for subscribing. I appreciate you guys. The subscribers are always the best. You guys are amazing. And I'm happy to help you guys any way I can. So thank you guys for always asking questions. I will say I'm probably the most accessible dermatologist on social media. I try to respond to every question you guys ask me, especially in the comment sections. So make sure to give me a follow if you guys don't. I'm pulling for TikTok. I hope it comes through. Maybe the next president can, you know, potentially save it. I hope so. Alistair, hey there, good to see you. Good to see a familiar face, Alistair. Thanks for being here. Moisturizer for rosacea. You've got a couple good options for that. I would go with either Avene, which is Avene, or I would go Vanicream, or Vanicream. Now, you're not wrong to go with things like CeraVe and things like that. Those are good options too. But I really, really like those options. So Henry CR, what now? It's going to be, I guess for now, Instagram or YouTube. I'm on those. So I've already been using those platforms for many years as well. So I'll probably be using those, you know, for the long haul. So Big U says, lately my face has been red and bumpy, burning and itching. What should I do? So for most people, if I heard that, I would kind of think rosacea. And the redness of rosacea can be treated with lasers, but the bumps are actually a little bit easier to treat. I would probably look Big Goose 75. I'd probably look into getting some type of topical azelaic acid. So The Ordinary makes one. Also, Paula's Choice makes one. And azelaic acid is a really good treatment for the bumps. And Aberdeen's Boutique says, hey Aberdeen, or Anne Breen, sorry, Boutique. Thanks for being here. I appreciate it. Katrina, thanks for all the roses. I appreciate it, Katrina. Lasers, there's a lot of different lasers for rosacea. So things like PDL, XLV, IPL, BBL. These are all good. Rate Vichy Durcos. I rated a 10 out of 10. I was involved in Vichy Durcos kind of coming to the market to a degree. I was on the board of dermatologists of 6 people that helped it kind of come along. So looking at its safety, looking at its efficacy, some of the, the marketing claims and things like that. So it's a really cool journey over a couple of years to get it here. It's the most popular, it's the most popular anti-dandruff shampoo in Europe. And so it just came to the United States. So that was really, really cool. What can I use for hormonal cystic acne? Pretty much 2 things. Oral spironolactone from your dermatologist can be very helpful, or you can get Accutane, which is very helpful. Someone asked Botox in the armpits to stop sweating, yes or no? I definitely say yes, especially if you've gotten to the point when you kind of need something more. Botox is very effective. And sometimes after you get a treatment, that treatment can last for 6 months. So that's a really nice aspect of it too. So I really like that. So, and it's very easy to get through. Safest biologic for psoriasis. So a lot of these are very safe nowadays. The IL-23s. Thank you so much for the join my team. Thank you. The IL-23s are very good. IL-17s are very good. So Derm medical assistant here. Thank you, Jackie. It's good to have you here. Thanks for being here, Jackie. Appreciate you. So how you doing today? So let's see. What is the best way to get rid of acne scars? So usually lasers, possibly some chemical peels, but they usually have to be more aggressive. So pretty much lasers, maybe microneedling. Sometimes small surgical procedures can do. So I'm not aware of any deodorant brands that are poison. I don't think aluminum in deodorants is harmful, personally, but that's all that. Double A says, hey, honey, thank you for your voice and support of the LGBTQ community. Well, thank you. I appreciate you being here, Double A. Thank you. And Anne Breen's Boutique, I have comedonal acne on my face. So comedonal acne is like the most common type of acne. So comedonal, if you guys don't know, means blackheads and whiteheads. So with those, the main treatment that you want to use for that is usually going to be either a benzoyl peroxide wash or a salicylic acid wash, and you want to use a retinoid like adapalene. Any routine that you do is going to take about 8 weeks to 12 weeks to show results. So you want to stay with it. I do at the link in my bio on any platform. You can go to my Shop or my Amazon, and you can get my favorite routine for acne, the most powerful routine for acne over the counter. I will say, if you guys don't follow me on YouTube, I definitely would follow and subscribe on YouTube, because I literally have a video called The Strongest Acne Routine You Can Get Over the Counter, and it is incredible. So I would check that out. These are routines that are not expensive. There's a lot of stuff that you can see that's kind of like adjacent to acne and can be a little bit, confusing and expensive. It doesn't have to be confusing and expensive. It just has to be consistent. So if you try that, that'll help. Forehead acne can be stubborn like any other acne. The nodulocystic stuff, deep acne that's painful, the bumps, that is going to be hard because you're usually going to need systemic therapies to help it. So systemic treatments. Do you have videos on YouTube for preteens? So the thing I'll tell you is almost like in general, all skin is more similar than different. So it doesn't matter if you're older, if you're younger, if you're a teen. Generally, good skin is good skin. And sure, in your teenage years, you're probably going to struggle more with acne than you will like as an adult or in your later life. But in the end of the day, the same, there's a lot of things that are going to, help across the board. So you can watch my videos. It's going to tell you how to get great skin. And my goal overall is to give you recommendations that are affordable and accessible and work. So yeah, so that's all good questions. And Anne Breen, you're very welcome. Happy to help. Keratos pilaris, Chris asked. So again, for Keratos pilaris, some of my favorite options are amlactin lotion and CeraVe SA lotion. If you use these together, rotate them, it's a really, really nice option. Nat Girl, thanks for being here. It's good to see you. Red light masks she asked about. So for red light masks, they're the cherry on top, right? So I have linked in my bio, I have 2 of them. that are linked, and it's the cherry on top. So I wouldn't, if you're just getting into skincare, I wouldn't jump to being the red light mask as the first thing to do. I would actually add that to your routine once you've got a good established routine. Once you're doing the basics, you're doing the things that work the most, that are affordable, vitamin C, sunscreen, and your retinoids, retinol, then in that case, I would, once you got that under control, then I would probably go ahead and add in the red light mask. I sometimes have a hard time using devices because it requires like taking, 10 or 25 minutes and actually doing it. So in that case, that can be really, really tough. So for me, just depending on how busy you are. Now, if you're sitting in front of the TV anyway, you're watching Netflix, whatever it is, and you have the time to do it, then go for it. But I think it's a cherry on top, and there are good options, and I think it does add something. But I would start with the things that are more effective and cheaper first. Jacob, Ashlyn, thanks for the roses. Katrina's, thanks for all the team bracelets. You rock. So Katie says, treatment for acne after getting off birth control. So as a lot of you guys know, birth control, a lot of the time, oral contraceptive pills tends to help acne. So that tends to make acne better. Now, things that make acne worse, usually hormonal IUDs, that can definitely make things worse. And a lot of people can kind of flare when they come off of birth control. Now, the issue is, if you're coming off birth control because you're trying to conceive, then you're very limited in what you can do for your acne. You can use over-the-counter acne washes like salicylic acid and benzoyl peroxide, those kind of things, but you can't use retinoids, which are one of the most effective things for acne. And you probably can't, I don't know, just depending on what you're trying to do. If you're trying to get pregnant, you can't use, Accutane, which is one of the best treatments that there are for acne. So you're kind of limited in that point. But what I would say is, if you're not trying to conceive, getting on a great skincare routine, which generally I like using a 4 or 5% benzoyl peroxide, and I like using La Roche-Posay adapalene at bedtime, that's about the best over-the-counter acne routine you can get. You want a good cleanser that's oil-free, it's not comedogenic. Tay and Sarah, thanks for the follow, guys. And again, I appreciate you guys. You guys are awesome. Thank you for being here. Thanks for subscribing. For those of you who invite your friends, so in Katie, if you want, and there's no pressure, but even if you just have this as a list, if you click the link in my bio and you go to my ShopMy or my Amazon, I have all the products listed there. If you're looking for an acne routine, exactly what, what you can get to kind of get it on a great acne routine. And Katie, I'm very happy to help you. Thanks for being here today. And sorry their acne is flaring, because I know it kind of stinks. So again, capillaries on the nose, best treated with laser. Itching after the shower, there's a couple things that can cause that. By far, the majority of it is just dry skin, and especially with a cold, dry air. That's the biggest thing. So moisturizing after the shower. There are some things that can be a little bit more worrisome, like particularly if your red blood cell counts are high and you're in the shower. Sometimes itching happens after that. That's something that you should pick up on routine checks with your regular doctor. Jacob asked about Jacob Sherman says 9 months of finasteride doesn't seem to be working for hair shedding. What's next? So minoxidil and finasteride are key to this. If you're using finasteride, I assume you're maybe using minoxidil. We got a jaw problem going on right now, so I don't want to yawn too big. But so minoxidil, if you're looking at hair concerns, and I know Rachel had a hair question too, minoxidil is going to be one of the most effective things that you can do for hair loss overall. And it's non-hormonal, but finasteride, incredibly effective, particularly for frontal hair thinning up here, because it blocks DHT, which is a strong version of testosterone that makes our hair shrink. I just did a video just the other day within the last 5 videos of all the treatments for hair loss. So Jacob, I definitely think you should check that out. I think you'd really enjoy that video. Things like continuing the finasteride, because it's probably doing a lot more than you expect. Even though your hair's thinning, it'd probably be much, much worse without the finasteride. But minoxidil, finasteride, PRP, hair transplants, these are how those things go. Red light caps. There are a lot of things you can do for melasma. So people ask about melasma. It is a very, very tough thing to treat. I think over the counter, one of the best things that you can really do is really just doing like remedy for dark spots is a great treatment. But a lot of the times prescription treatments are necessary. Things with hydroquinone, you know, those are going to be a little bit more effective. People do all kinds of stuff, microneedling with tranexamic acid, all of that stuff. Ohio State Erica says, my dermatologist sold me the same exact micro peel, same brand. I hope you liked it, Ohio State Erica. Hopefully it was a good one. Anything you can suggest for someone taking medicine that causes skin cancer? So most of the time, like things like transplant medicines, stuff like that, even biologics, some blood pressure medicines like hydrochlorothiazide, these all increase the risk for skin cancer. So if this is the case, you got to make sure you're doing the main thing that you can do to reduce skin cancer, which is protecting yourself from the sun. So using a great sunscreen is by far the most important way to reduce your risk of skin cancer. So thank you guys so much. Someone said ceramide moisturizer for oily acne prone skin. Then I like CeraVe moisturizing lotion. So I really like that. CeraVe moisturizing lotion is a very good option. So for the oily, so I'll put this in the chat. And removing acne scars is not an easy thing. It's usually going to require multiple treatments. Some people were asking about Obagi and Zeo skincare. Both are very good, but generally you won't find me usually recommending super expensive skincare. I really like things that are affordable, accessible. So one of the things that I like to find really good skincare, if you guys are looking for things, is I really like, there's an app that's called Brandify. It's the Brandify app, and it is incredible. Thank you so much for the hand heart. I appreciate it, BFan. So I'm going to put that in the chat, Brandify app. So the Brandify app is very good. It's an incredible app that you can find dupes of skincare. It's incredible. You can find good skincare dupes. You can learn about skincare products. So I definitely check that out. It's a great app that you can do. I do help them develop some of their skincare products. So like their vitamin C serum, I helped them develop a vitamin C serum that's formulated for acne prone skin. So I helped them develop that. And so I love that. Someone I saw said Dylan, but I don't know where that went. Maybe their name was Dylan. There have been what W happening? Oh, hey, is it Whipple? Is that who that is? What's up? How are you? Thanks for being here. Granulomatous colitis. It's tough. Historically, what I've seen for that usually is ILK injections. So it's intralesional Kenalog injections. That's been the main thing that I've seen for it, but it's tough. Removing pores from the face, unfortunately, you can't remove pores. You know, pores are going to serve a role. Like I have pores, of course. Pores are going to, you know, they serve a necessary purpose of getting oil out to your skin. It's a key thing that happens. So, you know, you're not going to get rid of them completely. Things like lasers can help remove or reduce the appearance of pores. There's also the Remedy for Pore Size product, Remedy for Pore Size, which I do have linked in my bio that you could go to, and just if you scroll down to pores, you could do that. OOA, I don't think I've saw your question, but if I see it, I'll answer it. And then any Korean brand that provides ceramide moisturizer for oily acne prone skin. I don't necessarily know about Korean brands, but I will say I really do like the Medicube brand in general. So the Medicube is a Korean skincare brand that's very good. You could also look into Dr. Jart. Dr. Jart, I believe, makes some really nice things too. So I would check that out. And then we have Epic Burrito, who's a wonderful subscriber here. And I thank you for being here. It says, I have acne on the back of my head. Any tips on products that can help? For sure. So Epic Burrito, you can, of course, there are great prescription products for this exact concern. But over the counter, what I would say is I would really lean into CLN shampoo. So CLN shampoo, they have like a gentle scalp one or a healthy scalp one. But I would get the CLN shampoo that has a little bit of salicylic acid in it. I think that would be your best bet for keeping those bumps down on the back of the head. Keeping the hair a little bit longer. If you go real short with the hair, you have a little higher chance of getting ingrowns. So you want to be a little careful on that front too. So those are some of the things you want to look out for there, but it can be very helpful. So yeah, all great questions. So yeah, as you guys know, again, Dr. Dylan Greeney, I'm a board certified dermatologist. I'm here to help you get your best skin. So thanks for being here, guys. As you guys know, we're 7 days away from the potential banning of TikTok, which is really sad. I'm live on here. I'm live on YouTube. If you guys want, I encourage you, because like I said, I love reaching all you guys, love helping all you guys get your best skin. But follow on Instagram and subscribe on YouTube. If you guys come over there, then you'll still be part of this community. You'll still have access to me. You'll still be able to ask those questions. I do really think I'm the most accessible dermatologist on social media. I try to be here for you guys. I try to be here for you guys. I try to help you guys along the way. Try to do videos that relate so much to you guys, that help you with common skincare concerns. Try to talk about products that are affordable but effective. That's what I do. So SwoleMD Skincare on YouTube. You can also find me SwoleMD on Instagram. So if this happens to go away as an app, which I sure hope it doesn't, but then I would definitely love to help you over there. So Dylan, the adapalene is drying and irritating. It is annoying. Any tips? So for sure. So OOA. So one, you want to make sure you're using the adapalene only every other night. Now, if you got the adapalene that I usually would recommend, which is La Roche-Posay, I would make sure you're following the instructions on it, because the instructions on the La Roche-Posay adapalene are the best instructions of any adapalene. It talks about using a pea-sized amount. It talks about using it only every other night or every 2 nights and increasing it to nightly as tolerated. A couple things you can do if you're getting dry and irritated, which, as you may know, this is something that I would expect and is very common for anybody using a adapalene or prescription tretinoin. It's going to be a little drying in the beginning, and that's okay. But what you can do to help balance it out is you can start doing a little bit of moisturizer on your skin before you apply the adapalene. After you apply the adapalene, you can do another layer of moisturizer, and that's a really, really nice thing called a retinoid sandwich. We can help reduce that irritation and while your skin gets used to it. So I would definitely lean into doing that. Okay. Short or long hair better suited for applying the shampoo for my scalp acne. So in general, having a little bit of longer hair is better, because the short hair is going to be more likely to get ingrowns, and those ingrowns are sometimes what causes the bump. But I really think that would help you. Cab Trio can be used every day. It can be drying like any other acne treatment, but usually you would do it every day. And then the question was, how often should I use my Paula's Choice exfoliator? So Kolb asked that question. I personally would be using an exfoliator around twice a week, about 2 times a week. You can use it at bedtime. And Epic Burrito, you're very welcome. I'm happy to help you. And thanks again for having the skincare badge. It looks great on you. And thanks for being a subscriber. So thank you. Thank you. Black Salve, horrible idea. Don't do it. Terrible idea. Don't do it. Do not do it. Don't do it. You can just Google a little bit, and you'll end up getting pictures of people that have burnt their skin off with that stuff. A favorite OTC retinol, I would say probably ROC, ROC, or actually just doing the Remedy for healthy aging. They have great retinol in it. I like ROC and I like Remedy. These are good options. The Brandify one is also very good. So again, I'll put it in the chat, but Brandify. And then if you happen to use Greeney 40 on the Brandify Skin website, you get 40% off. And I got that for people on here for people just because I do help them make some of their products. I'm an advisor for them. So I got, for my followers and for my patients, I got that Greeney 40 coupon on brandifyskin.com. Their vitamin C is the best vitamin C there is. Okay. Hands down. The retinol is very good too. The other thing that I really love from them is the peptide serum. So those are all really, really nice options, and you can get them 40% off with that code. I don't make any money from using that code. That's not the point of it. The point is I wanted a code that could help some of my followers and help my patients. And so you can use that code on brandifyskin.com. Very good. And then cheekbone dark spots, Claudia. My favorite thing right now is Remedy for dark spots. And what I can do is I can drop a link for you if you want. I'll drop a link for you so you have it. And this is the best over the counter there is right now for dark spots, without a prescription. So it's very, very good. If you guys are looking for a dark spot treatment, that's a really, really good one overall. You check that out. Different gel's very good too. So Different, is the first people that kind of came up with adapalene. So it's very, very good. Squamous cell skin cancer is the second most common type of skin cancer. And squamous cell, you're very welcome, Claudia. Thanks for being here, and thanks for asking a great question. That's a question that a lot of people would have. So yeah. So what I was going to say about squamous cell carcinoma, second most common type of skin cancer. It's one that if you do neglect it, it can actually metastasize and spread. So it just depends on how deep it is. So things like squamous cell carcinoma in situ, those are very mild squamous cell carcinomas. They're not very deep. It's a little bit of a safer bit. But if you leave that a long time, it can become invasive and harder to treat and need to be treated with surgery, things like that. New moles can happen to people. They're kind of cooked in genetically. They're a little bit more common in areas of skin that has been sun exposed or sun damaged, or in families with a history of a lot of moles. So you can continue getting new moles, particularly through age 40. Then it tends to slow down, but unfortunately you start to get other kinds of benign growth like seborrheic keratosis and lentiginous after that. How to improve skin hydration in your 40s. I like the humidifier in the bedroom, moisturizing after every shower, moisturizing for bedtime. Possibly taking like a reasonable dose of fish oil may also help your dry skin concerns as well. Icing the face overall, I would say don't do it unless you got like, maybe you're just doing little eye bags or something when you wake up or something like that. But putting the ice cube directly in the face, skin's going to look red. I think it's a little harsh for it. Proactive, I think they do have good ingredients. I really haven't used anything from Proactive in a long, long time. I would give it about a minute or so between products, but a lot of times realistically, I pretty much put my products right on top of one another. But I don't use too many things that are active at once. So like in the morning when I get ready, I'll pretty much just wash my face. So right now I'm pretty much using the La Roche-Posay Tolerian foaming facial cleanser. I use that. I put on, and this is kind of, I don't usually use expensive stuff, but I've been using it lately. I use the Charlotte Tilbury Glow Toner. I put that on. I put on Drunk Elephant Marula Oil. So the Glow Toner does have some actives in it, like niacinamide. The Marula Oil is like an antioxidant, but the oil aspect of it kind of gives my face the nice shine. You can see the light reflexing off my face, makes my skin feel hydrated. Then I go ahead and just throw right on my sunscreen, which I'm using the Peter Thomas Roth Water Drench Tinted Moisturizer Sunscreen, which I love that. Good moisture while I'm getting rid of Malacacea. I would really just go with like the CeraVe Moisturizing Lotion, which is a good option overall. Is there a way to safely tan while on Accutane? Not really. Pretty much just, there's no safe way to tan ever. Any bit of sun you get increases your risk of skin cancer. So the more sun you get, it's kind of like a cumulative dose effect. It's increasing your risk for precancers and squamous cell carcinomas. Burns and stuff, of course, increase your risk for melanoma, basal cell. So the only way you could do it is a spray tan. Spray tan is probably not going to work real well during Accutane because your skin's going to be dry. And obviously, you guys know if you have dry skin and try to get a spray tan, usually doesn't go over very well. So thoughts on red light mask. They're the cherry on top. If you have the rest of your skincare routine right, then in that case, you may want to look into getting, doing those. But you wouldn't, you don't have to do that. It's the cherry on top. You know what I mean? Don't know much about the watermelon thing that someone asked about. Thoughts on erythromycin with benzoyl peroxide. Very good. Bacteria is one component of the whole acne kind of issue. So acne, part of it is inflammation, part of it's oil buildup and blockage, part of it's hormones, part of it's bacteria. So erythromycin and benzoyl peroxide fight acne from two ways. Erythromycin more from the bacteria standpoint, benzoyl peroxide also through the bacteria, but also a little bit anti-inflammatory. So it helps on all those reasons. And I like those. Those are very good. So I'll remind you guys again, we're 7 days, 1 week from possibly TikTok getting banned. So I'd make sure you guys give me a follow. You know, follow me on another platform. Follow me on SwoleMD Skincare. Follow me on SwoleMD Skincare on YouTube. Follow me on SwoleMD on Instagram. I'm at both of those places. Some people are asking where I'm actually located at. I'm in Indiana. I am taking new patients. I do both medical and cosmetic dermatology 50-50. So marionette lines, it's kind of tough. I mean, depending on how bad they are, you know, obviously facelifts are an option if it's real bad. Doing things like biostimulators like Sculptra, doing things like hyaluronic acid fillers, injectable fillers, those are some of the ways. Subtly improve the appearance of some of the cornering in the mouth and stuff by Botox injections in areas that pull our mouth down, like that, these muscles. So if you can get those, that helps. Crazy amount of redness on the face, very dry and broken blood vessels. Really, oh, I love the cowboy hat. Thank you so much. Thank you. Appreciate that. That's awesome. Terminally chill. Like the name, by the way. So, we were saying, what was it? Getting rid of milia, salicylic acid, and adapalene. I would definitely look into those. Sponge derm, white spots all over. I don't know. It kind of sounds like pityriasis alba. I would just lean into good moisturizer use, and your dermatologist probably giving you, you know, mild steroid use for a while. Just using gentle skincare is the key a lot of the times to letting your skin kind of heal. Best shampoo for every day, dude. I've been using a new shampoo. It's like it's not a liquid, it's a bar one. Can't even think of the name of it. It was so good though. I'm gonna put it in here. I'm gonna shout them out because it was so good. That's what I'm using right now. It's called, I'm looking for it right now. Had like a kind of a neat name. Oh, it's called Ethique. It's a very good shampoo. So I really like it. I've been using the one that I think it's for dry and flaky scalp is what I'm using. So it's called Ethique. And I will and I think actually they said it rhymes with unique. So maybe it's, I don't know. I know I'm probably saying it wrong, but I like it. So I'm going to put the name in here so you guys have it. So I really like this one. Here's the name of it. If I can copy it. Can't copy it. All right. So I think it's this. I'm going to type it in here. There you go. So Ethique. That's the one I'm using right now, and I actually really like it. It's a bar shampoo. Kind of figuring out, like, do I rub the bar on my hands or do I rub the bar directly on my scalp? I think I saw images of people rubbing it on their scalp, so I've been doing that on my hair. It's really good. Back acne, pretty much it's tough. It is good for women. My wife's actually used it, and she really likes it. The conditioner too. Like, I've been using the conditioner, and you can run your hands through your hair really nicely. Your hair feels soft. It feels hydrated. It's very good. So she liked it a lot too. So different. It made my skin look so bad. So a lot of that probably comes down to just how you're using it, expectations, doing it properly. Because it's true. A lot of times when you start these, your skin's going to look worse before it looks better. Cystic acne gels is really the only way to do it is with Accutane. A way to just start using vitamin C. I would bring it into the routine, definitely, like in the, you know, you could use it anytime. I mean, as long as you're not like totally tore up with acne, and even if that's the case, you could use a good acne routine, and once you get your acne under control, you could bring in vitamin C. But a lot of times with vitamin C, definitely in the 20s, you know, you want to be supporting that collagen. So vitamin C is going to be an antioxidant on your skin. It's going to help support your collagen. Thanks for the tiny dining angel. And it's going to help to stabilize the collagen and support the collagen. So I would say definitely in your 20s, but you can use it in your teenage years and get benefit. Now, sometimes vitamin C breaks you out. We've talked a little bit about Brandify, Get a Glow. And with the code Greeney40, you can get a great vitamin C. If you're acne prone, they have the salicylic acid containing vitamin C, which is very good. You can use that one. If you're, you know, not acne prone, you can use the one with the blue label, which is like your regular vitamin C, but it has ferulic acid. It has L-ascorbic acid. Is very good. Can you use vitamin C and peptide serums together? I had no clear answer. So TDS, you can, and that was a very, very heavily debated topic. in the beginning of TikTok, really. So, and unfortunately, I think we're kind of at the end of TikTok now, sadly. I mean, maybe we're a week away. So that's why I'd love for you guys to follow me. If you follow, you can use the links in my bio to get to all my other socials. So SwoleMD Skincare on YouTube, at SwoleMD on Instagram. Thank you guys for the follows. I see them rolling in now. So I really, really appreciate you guys. Thanks for being here. So best skincare. So Jordis FX, the best skincare for sensitive skin. I would say if you're looking at sensitive skin, Vanicream or Avène these are very, very peak. Now your CeraVes and La Roche-Posay are good options too, but I think when it comes to true sensitive skin, I really love Vanicream and I love Avène. Those are very, very good. So blue dye rashes. So if you have a known rash to something, that's called allergic contact dermatitis. So if you have that, you have to avoid things with that in it. There's no other way about it. I mean, otherwise you're going to get broke out. TDS, thanks for the subscribe. I appreciate you. That's allergic contact dermatitis. And the gold standard treatment is avoidance of the contact allergen. So there's different websites now where you can put in your allergies and you can generate a list of things that are safe for you. So I kind of look into something like that. Treating fungal acne on the face, my favorite treatment for that is one called ScrubMD. So Stephanie, for sensitive skin, I'll put it in the chat, but Avène or Vanicream, I'll put it in the chat. There you go. There's not a cure for rosacea, unfortunately. So those are good options. Why does my skin hate SA but love BP? I don't know. I think overall salicylic acid is a little bit more drying, so maybe that's the reason, Addie. But they're very different compounds. I mean, overall, they're incredibly different compounds, and they're both good. So Paula's Choice, mandelic acid, good for teen acne. It's not bad for acne, but it's not the best for acne. Tyler, what's Avène for? Avène is basically for usually sensitive skin, I'd say, in general. Dandruff right now, the best treatment out for dandruff is Vichy Durcos. So this is Vichy Durcos. I'll put this up here. Thank you so much. So Get a Glow. If you want to know right now, the few things that I have on my face at the moment, I have Charlotte Tilbury Glow Toner, Drunk Elephant Marula Oil, and I have Peter Thomas Roth Water Drench Tinted Moisturizer. Silky says, I had a patch test on my back, didn't react to allergies, but broke out all over from the tape. Other areas, not just the back. Yeah, so there's something called an id reaction, Silky. And sometimes you'll get it. That's a reaction that's like more vigorous. So it's like not just where you had an exposure to something. This can happen with weird stuff like toenail fungus. You can have toenail fungus and then you get a rash all over your body. And it's not like there's fungus all over your body, but your body is reacting to that allergen very aggressively. So obviously you have a adhesive allergy and your immune system is very ramped up to that allergen. And then you broke out everywhere. So really, really, really sad. And Get a Glow, thank you so much. I appreciate you being a subscriber, and I'm so happy to have you here. And great questions, actually, that you asked today. So thank you. So I appreciate you guys. So again, guys, I'm Dr. Dylan Greeney. I'm a board-certified dermatologist. I'm essentially begging you guys to follow me on other platforms because I'm actually down inside because I've worked so hard to build this TikTok platform, and I've been able to help you guys so much over the years and reach so many people. And I'm really worried that we're going to lose this right in the next week. So I don't know what's going to happen. I don't know if the next president's going to save TikTok. Maybe is Mr. Wonderful going to buy TikTok? Thank you for the heart. I don't know what's going to happen, but I appreciate you guys. You can look me up on any platforms. Dylan Greeney, SwoleMD. You can find me on YouTube, SwoleMD Skincare, Instagram at SwoleMD. You can find me in there. I'm on Pinterest. You know, I'm everywhere. So, port wine stain on the face. My newborn has it, and that's common. You know, a lot of kids will have these vascular lesions. They can be treated at the appropriate time with lasers. So sometimes it can be tricky. Schooling to become a dermatologist, it takes 12 years minimum to become a dermatologist. So it's a long road for sure. So cellulites, there's no topical treatments that are really going to help those. I will type the dandruff medicine one more time, and it is in the chat right now. It's called Vichy Dercos, Vichy Dercos. So you guys are all amazing, though. I appreciate, you know, the 100 or so of you that subscribed today. So thank you guys. You guys are amazing. You guys, if you didn't get your question answered, if you go ahead and do follow, just tap the follow up there, then you can pop over to my most recent video, and you can ask it on that in the comments there. I'll make sure to answer those for you today. So again, if you did not get your question answered, ask it on my most recent video in the comments. I'll get it for you. Make sure to follow me on Instagram, follow me on YouTube, and I'll be here for you guys. So I'd love to see you guys over there. I may do an Instagram live. I'm not sure yet. I might hop on Instagram here in a second, but you guys are amazing. I sure hope I don't lose access to you guys with the TikTok ban. Hopefully it's safe. Like I said, ice pick scars are really tough. There's a treatment called TCA Cross that can be helpful for people. I don't watch Park and Rec, unfortunately, even though it was based on the town, from what I understand, that my wife is from. So, but you guys are amazing. Thanks again. I appreciate you guys. I might see you guys in a little bit. I'm going to shut it down. Dermatologica is good. I like it. SwoleMD, so happy that you grabbed it. So I'm going to have to get a picture of that and send it. I love that. So thank you guys. You guys are amazing. Again, I'm Dr. Dylan Greeney. Love you guys bunches. You guys take care, and hopefully I'll see you on the other platforms if this goes away. But if we end up here on TikTok, that's better. I love you, YouTube. I love you, TikTok. You guys are amazing. So thank you guys so much. Take care, and we'll see you soon. Okay, bye-bye.